So we're looking at two aspects today in pathology. This is what is known as necrotizing papillitis, then also the renal papillary necrosis. So for these ones, you can see basically, that was the problems of the kidneys. You can see how this kidneys is necrotic, cells are dead. That's basically what we say necrotic. And papillitis, anytime I see itis, I deal with inflammation. So renal papillary necrosis, also known as necrotizing papillitis, is a condition characterized by what? There is ischemic necrosis of the renal papillae and the medullary pyramids. So this is a renal pyramid, this is a renal papillae, this is a renal medulla. Of course, you know that pyramids are found in the medulla. So it's these three portions of the kidney we are talking about. So it leads to loss of renal function and can result in kidney failure. So causes of renal papillary necrosis is associated with several underlying conditions. So sometimes diabetes mellitus, most common, sickle cell disease, chronic pyelonephritis, analgesic nephropathy, usually due to overuse of what? NSAIDs, renal vein thrombosis, urinary tract obstruction, renal tuberculosis. Alright, for all possible causes. So symptoms is what? Flank pain, hematuria, blood in urine, fever, chills, rigors, if infection is present, oliguria, anuria. Obstruction symptoms due to slurred papillae. So diagnosis is imaging studies like CT scans, urography, IV pyelography. So you also see what? Ball on T sign, right? Lobster claw sign, signet ring sign. Alright, so necrotic papillary tip with an excavated calyx. So urinalysis may reveal cast, alright, cast in urine, hematuria, pyuria. Okay, then histopathology. Histopathology confirms necrosis and slowing of the papillary tissue. Treatment and management is what? Always treat the underlying condition that is causing it. You can give antibiotics if you are dealing with an infection. Pain management to avoid nephrotoxic non-steroidal anti-inflammatory drugs. Surgical intervention if obstruction occurs due to slurred papillae. Then you do dialysis or kidney transplant if the issue is now becoming advanced.